The techniques used in AI radiology. AI radiology, or the use of artificial intelligence in medical imaging, involves several advanced techniques, computer-aided algorithms. These are designed to automate the reading of medical images such as X-rays, CT scans, MRI, and ultrasounds. By training computers with tens of thousands of normal and abnormal images, these algorithms learn to distinguish between normal and abnormal findings. Machine learning, ML algorithms are trained using large datasets to recognize patterns and anomalies in medical images. The more data the algorithm is exposed to, the better it becomes at identifying subtle differences that may indicate disease. Deep learning, DL, a subset of ML. DL uses neural network-based architectures to analyze radiological scans. These models can be trained to perform complex tasks, such as identifying specific features in an image that may indicate a particular condition. Functional imaging. This technique is becoming part of care, focusing on interpreting data from images to provide higher precision in diagnosis and treatment, particularly in cancer care. It allows doctors to monitor tumors and the spread of cancer cells more effectively, exploiting massive computing abilities. AI-driven techniques in radiology leverage the massive computing power to mine body scans for differences that might be missed by the human eye. This involves analyzing every data point to distinguish disease from health and signal from noise. These techniques are transforming radiology from its initial focus on diagnosing medical conditions to playing an integral part in treatment, especially in the area of cancer. The ultimate goal is to improve patient care by detecting problems earlier and with greater accuracy than the technical processes using AI radiology. The technical processes in AI radiology involve several key steps and components. Data collection. Large datasets of medical images are gathered. These images are often annotated by radiologists to indicate areas of interest or diagnoses, which serve as a reference for training AI models. Pre-processing. Before analysis, images may undergo pre-processing to improve their quality. This can include noise reduction, contrast enhancement, or standardization of image sizes and scales. Algorithm development. Algorithms, particularly machine learning and deep learning models, are developed and trained using the collected data. These algorithms are designed to recognize patterns, anomalies, and features in medical images. Training and validation. The AI models are trained using a portion of the dataset and then validated on a separate set of data to ensure they accurately identify medical conditions and are not overfitting to the training data. Integration with radiology information systems. RIS AI is integrated with existing RIS to streamline workflows. This includes automating tasks like image pre-processing, report generation, and follow-up recommendations, allowing radiologists to focus more on patient care, detection, characterization, and monitoring. AI assists radiologists by detecting abnormalities, characterizing them to understand their nature, and monitoring changes over time to assess treatment effectiveness or disease progression. Continuous learning. As more data becomes available, AI models can continue to learn and improve, refining their ability to assist radiologists in diagnosis and treatment planning. These processes collectively enhance the efficiency and accuracy of radiological assessments, leading to better patient outcomes. Some common AI algorithms used in radiology. In radiology, several AI algorithms are commonly used to analyze medical images. Convolutional neural networks, CNNs. These are specialized deep learning algorithms that are particularly effective for image recognition tasks. They can identify patterns and features within images with high accuracy. Recurrent neural networks, RNNs. While less common than CNNs for image analysis, RNNs are useful for analyzing data where the sequence is important, such as time series data from functional imaging. Autoencoders. These are used for unsupervised learning tasks, such as dimensionality reduction or feature extraction, which can be helpful in identifying relevant features in medical images. Generative adversarial networks. GNs can be used for data augmentation, generating synthetic medical images for training AI models without the need for additional real patient data. Transfer learning. This involves taking a pre-trained AI model developed for one task and repurposing it for a new, related task. It's often used to adapt models to specific radiology applications with limited datasets. These algorithms are integral to the development of AI tools that assist radiologists in diagnosing and treating diseases more effectively. The way CNNs work in radiology. Convolutional neural networks, CNNs. are a class of deep learning algorithms that are particularly well suited for analyzing visual imagery and are extensively used in radiology. Here's a simplified breakdown of how CNNs work in this field. Input layer. The process begins with the input layer, which receives the raw pixel data from medical images such as X-rays, MRI, or CT scans. Convolution layers. These layers apply various filters, also known as kernels, to the input image to create feature maps. These filters are designed to detect specific features like edges, shapes, or textures. Activation function. After convolution, an activation function like the rectified linear unit, ReLU, is applied to introduce nonlinearity, allowing the model to learn more complex patterns. Pooling layers. These layers reduce the spatial size of the feature maps to decrease the computational load, improve efficiency, and help the model to generalize by focusing on the most important features fully. Connected layers. After several rounds of convolution and pooling, the high-level reasoning in the neural network occurs in the fully connected layers. Here, the features are flattened and connected to create a final output that can be used for classification or detection tasks. Output layer. The final layer outputs the predictions or classifications, such as identifying the presence of a tumor or classifying the type of tissue visible in the scan. Backpropagation. During training, the CNN uses backpropagation to adjust the weights of the filters to minimize the difference between the predicted and actual outcomes, improving the model's accuracy over time. In radiology, CNNs are trained with large datasets of annotated images and learn to detect and diagnose medical conditions from new images, augmenting the radiologist's capabilities and potentially improving patient care. They are particularly good at handling the vast amount of data contained in medical images and providing insights that might be too subtle for the human eye to detect. Some limitations of CNNs in radiology. Convolutional neural networks, CNNs, have several limitations when applied to radiology data requirements. CNNs require large amounts of labeled data for training. In medical imaging, acquiring and annotating such datasets can be challenging and time-consuming. Overfitting. Without sufficient data, CNNs can overfit to the training set, meaning they perform well on the data they've seen but fail to generalize to new, unseen images. Interpretability. CNNs are often considered black boxes because it can be difficult to understand how they arrive at a particular diagnosis or conclusion, which is a significant concern in medical applications. Computational resources. Training CNNs requires significant computational power and memory, which can be a barrier in some settings. Integration with clinical workflows. Integrating CNNs into existing clinical workflows can be complex and requires careful planning to ensure that they support rather than disrupt clinical practices. Regulatory and ethical considerations. There are also regulatory hurdles to overcome before AI can be widely adopted in clinical practice, as well as ethical considerations regarding patient privacy and data security. These limitations highlight the need for ongoing research and development to optimize CNNs for clinical use in radiology.